Today we're here with Professor Fiona Bohosian, all the way from Australia. How are you, Professor?
I'm very well, thank you.
Why actually did you come here with the workshop and everything?
Well, Dr. Craig Lambert and I met in the Universitas 21 meeting last year in Shanghai, and I conducted a small simulation workshop there. And as a result, we thought that there was enough in common for me to come and visit to help kickstart simulation research in education.
Do you think you have achieved what you came here for?
Well, I think the workshop was very successful. I'm yet to see the evaluations, but I think it generated a lot of interest across the disciplines in the faculty, as well as setting a future direction for the activities around simulation in this laboratory.
We've just completed our first simulation workshop here in our new facility at the UJ. The workshop really went off well. We had delegates from across the country as well as internationally. We had all of the academics involved in education and education through the use of simulation. And what we did is we each did a presentation and we had discussions about how to use simulations for assessment as well as teaching and learning.
So she's going to see what we do and then provide some feedback.
How far is the process possible?
I've never seen.
Have you seen any other simulations from other universities?
Yes, I've seen quite a few simulation labs, but this one is particularly impressive for a number of reasons. Given the confines of the building where the simulation lab had to be situated, there's been a lot of thought put into how to use each of the individual rooms. And I guess what's impressed me most that I haven't seen before is the simulation labs with the nice tiered seating where the students are sitting, observing one another, and also the open ambulance bay that's there. That's really something I've not seen before, so very useful for emergency medical care.
What exactly is it that stands out for you?
Well, I think there's an extraordinary commitment from the Faculty of Health Sciences towards simulation, probably spearheaded by Dr. Craig Lambert and his team. There's an extraordinary amount of work that's gone into getting the simulation labs to their current state, and I think now they just have to reap the rewards of that in terms of research and education benefits.
The workshop was over 4 days, and I think that the outcomes of this workshop are that we all going to be involved in collaboration moving forward in determining the best way to use simulation for purposes of clinical learning.
I've learned that there's a lot of passionate people here, all across the country, trying to make medical, nursing, midwifery and radiography education better by using simulation.
Thank you, Professor.
Thank you very much.
Thank you, everyone.